are here. Good morning. Thanks for coming to our session. Casey and I are both from Virginia Commonwealth University, and we are going to talk about a study that we did on infant mental health endorsement in Virginia. Since we're a small group, if you want to either share in chat or unmute who you are, what your role is, and what your interest in the endorsement process might be. We'll be really informal this morning. We'll talk about why we did the study. We'll talk about the study a little bit, but then we have, at any time, feel free to ask us any questions. Glad you're here. So Alicia is from St. Louis. Welcome. Glad you're here. Hi, Crystal.
Hi.
Good to see you this morning. So I am Christine Spence, and I am an assistant professor of special education at Virginia Commonwealth University. Prior to my role here at VCU, I worked as an early interventionist and a professional development specialist in an early intervention system. And so I have a background in music therapy with a very strong background in psychology, and so used infant mental health practices throughout my career, but didn't formally start working within the infant mental health field until more recently. And I'm actually currently going through the endorsement process at the mentor level at the research and faculty specialist. Casey, do you want to introduce yourself really quickly?
Yeah. Good morning, everybody. My name is Casey Dye, and I am a second-year doctoral student at VCU, Virginia. Sorry if you can hear my dog fall off the couch. So yeah, I am studying special education and disability policy. I was previously a special education teacher, and I've been working with Christine this year. So we're excited to present our findings.
And so at VCU, we have one of our centers is the Partnership for People with Disabilities. And since 2010, we have held the grant and worked with the infant mental health endorsement process and the Early Childhood Mental Health Virginia program. The Virginia Association for Infant Mental Health, or VAME, holds the license through the Alliance for Infant Mental Health with Michigan to do the endorsement, and then VCU and VAME have an agreement for us to administer it. And so over the past 12 years, we have been working to have infant toddler specialists endorsed in infant mental health across Virginia. And so we decided in this past year to take a formal look at who is everybody. We have the state database, but also what does this mean? What happened and what is their experience through the process of endorsement, as well as once they're endorsed? What do the endorsees describe as the benefits or the barriers to endorsement, and then that will help us to think about where to go next. We're in the process of starting the early childhood mental health endorsement. We have a pilot cohort going through this year, and then we'll launch it next year in a larger scale. And so we wanted to use some of the findings from the infant mental health endorsement process to help inform what changes maybe we should make over this next time. So that's a quick bit of the context. And so we have had 289 people either go through the endorsement process or indicate interest in the endorsement process and start the paperwork for the endorsement process in Virginia in the past 12 years. With that 289, we sent out an online red cap survey to everyone who is in the database and asked them to do responses, about a 10-minute survey. We had 115 respondents. We asked them what level they were endorsed at, or if they were in progress, or if they're no longer endorsed. And then we used skip logic in order to then give the appropriate set of questions based on their category of endorsement. And so you can see that we had the bulk of our respondents were infant family specialists, and not everybody indicated what category they were in, but this for the currently endorsed or the in progress are indicated there in that current category of endorsement or in progress. We have fewer mentors. We do have more over the past year that we've been trying to do. We're trying to really focus on building up the clinical mentors within the state. But right now, the associate and specialist categories are where we have the bulk of our endorsement. And so we wanted to also know, where are people, where across Virginia? And so as you can see, we have a map of Virginia. We mapped it onto our READY regions, which is our Virginia Early Childhood Foundation map of the different regions where early childhood services will be administered fiscally in Virginia. And so not surprisingly, we have the most number of endorsees in Northern Virginia, in the Arlington, Fairfax, DC suburbs area, and then kind of along the 95 corridor down into the Richmond area, which is where we happened to be. And then a few out towards Norfolk, Virginia Beach, Chesapeake, and then some in the Charlottesville area. So again, our respondents really mapped onto our population centers in Virginia. If you look at the lower third of the map, where we have much more rural areas of Virginia, that's where we had one respondent for many counties in every area. And so one of the things we also want to think about is how do we make sure that we have access to infant mental health services for children all across the state. And again, this is representative of the individuals who responded to the survey and not necessarily everybody who is currently endorsed. So we asked, what was your purpose for pursuing endorsement, and what is the impact of endorsement for you? What were the benefits, either as you went through the endorsement process or once you were endorsed? What ongoing benefits have you received? What were barriers, either barriers as you got into the endorsement and were going through it, or once you were endorsed, what barriers have you had? And then for those who are no longer endorsed, what barriers did you experience and why are you no longer endorsed? And then we also asked participants to give us some recommendations. If there were any, on their wish list, what are some things that you would like to see us do within the system? So Casey will talk a little bit about those.
Yes. So for the individual's purpose for pursuing endorsement and the impact of the endorsement, a lot of people said that their job required it, or that they wanted the credential to kind of prove that they knew what they were talking about, sort of as validation. And then many people said to better support children and families, and to just gain more knowledge about the field in general, and then connecting with others and collaborating. And a few people mentioned that after the endorsement, they were collaborating with others who were endorsed in other states. So that was exciting to hear. And then we pulled out a few quotes that we thought were pretty interesting. So the one that we have for this is that my culture has not always embraced supporting healthy social and emotional methods of child development. It's important to me that there is representation in this field so that more people will open their horizons to understand the importance of this topic and the good it can do for our children and families. And then for the benefits of the endorsement, most people said that they felt a sense of accomplishment. And again, that credential piece, having that sort of validation for I know what I'm talking about because I have this endorsement. And then, of course, professional growth and then networking. So again, the collaboration piece, getting to talk with others who are endorsed, that was important. So this person said that it's given me a wider network of professionals to work with, has allowed me to expand my professional work options, and to take a deeper dive into working with children and families. And we also asked about the barriers to the endorsement process. And many people said that the biggest barrier for them was that it was just kind of a long process. Some of them had difficulty with the website. Money was an issue. especially if they didn't know about the scholarship opportunities. So you can see that one of our total survey participants, we had 115, and then in the other category, one person said that they were accepted into the endorsement program, but they didn't pursue due to lack of funding. So spreading knowledge about the scholarships would be important for us. And then just the time in general, the need for additional support. And then some people said that the pandemic was also a barrier, just finding time during the craziness of the pandemic. So this person said that cost was a barrier until I learned that Part C was offering a scholarship or funding, and that their agency will not cover the cost. And then lastly, we asked the participants what recommendations they had to improve the endorsement process. A lot of them said that building a professional community, or also having like a cohort so that they could connect with other people better and make these connections with other people that are in their field, having additional scholarships, and then providing clearer expectations and examples, especially like examples of completed portfolios that was requested. And then having some sort of financial benefit for completing the endorsement. Some people said that their work didn't really value it, or they weren't seeing a financial gain from it. So having a financial benefit was important to them. And lastly, this person said that the process was helpful and smooth, but I wish there was more follow-up and opportunities to practice and grow once endorsed. So yeah, that was an overview of what we saw in the survey.
And so I just added into chat, over the course of the past 12 years, we've had different points in time where we've had scholarships and from different entities. And so we really want to thank those entities, but also recognize that that's one way that we were able to have some of the barriers removed for individuals. But if in any given year, one of those entities didn't have the funding for the scholarships built into their budget, then those sectors were not able to do it. We actually have a high percentage of Part C providers who have gone through the endorsement process, because our Part C entity, the Virginia Department of Behavioral Health and Developmental Services, provided scholarship funding for multiple years. And so it's nice that we have early interventionists who can also provide infant mental health services. And then the Early Impact Virginia is our home visiting program, and the Department of Health is currently providing some scholarships that we're working towards, particularly infant family specialists and infant mental health specialists. We also know that lack of capacity for reflective supervision is one of the biggest barriers, and one of the costs associated with continuing the endorsement process. And so that's one of the priorities over this next year for us in Virginia. So that was just a very quick overview of our study. We'd love to hear any questions you have, or what does endorsement look like in your state? Does this resonate with you? What questions have you struggled with? What solutions have you come up with that all of us can benefit from? So feel free to unmute your microphones and share your stories, your questions, or add questions in the chat.
Hi there, this is Nagar, and hi.
Nagar.
How are you all today?
We're good.
Good. So I have just a quick question, and I can't join for this whole meeting. I have to transition to another meeting. So I thought I would just pop in for all I could and just ask a quick question.
Sure.
Thank you so much. If someone is interested in endorsement, but may possibly be changing states and the state of residence in the next year or 2 years, whatnot, do you recommend they pause and not go? I live in Virginia right now, and not go for endorsement until they're sure, or is it kind of seamless, or
Excellent question. So there is no one stock answer to this question, as you probably know, right? So Virginia is part of the Alliance, and the Alliance covers about 30 states. And so there's not a automatic reciprocity, but there is often an understanding and some reciprocity. And for those who know more about the alliance and reciprocity, if you have moved states, please feel free to chime in. Part of it is going to be that means that there's 20 states plus a few territories that are not part of the alliance. And so where do you go? So like, I know Illinois has a very robust endorsement program. They are not part of the alliance, so it is completely separate. And so would they take the background and the work and everything you've done and provide an endorsement? I don't know. And so I think, and then some states don't have as robust of an infant mental health organization as others, and may not have an endorsement process within that, within their tiered systems and things like that. And so part of it depends on what state you may or may not be moving to. The knowledge is always a great benefit, and that, as some people talked about with that, but that is definitely something we noticed. And we did have a few people who talked about they're no longer endorsed in Virginia because they moved and they did not pursue endorsement in their new state. A couple of them did say that they did. We also had people who moved into Virginia who were endorsed in another state and then were recognized with their endorsement here in Virginia. So others, feel free to chime in with more responses, more answers there.
I don't have an answer about that specific issue. I have a different question, but does anyone have an answer for Nagar's question before I? No. Nagar, I'm thinking of doing the same thing. I live in Virginia. I work at Georgetown, but for many years I worked as a home visitor in Virginia and looked into this process a long time ago and didn't pursue it. I guess I have a question for you about one of the requirements is to receive reflective supervision with an outside person. And I was wondering why there wasn't an assumption that the person, if they're a home visitor, isn't receiving reflective supervision in their work site, and why that duplicative service is required outside. Is that because of, quality control, the quality of supervision?
So we are very excited that there's lots of reflective supervision that happens within agencies. One of the things that has happened over the past few years, we try to have endorsements through cohorts. And so the cohort, it's group reflective supervision. And so the cohorts have that experience together. And so through the first year of, we've applied for the endorsement, and then you have, and over the years, it's changed a little bit. This current iteration is that each month there's a 4-hour set of trainings, 2 hours around knowledge, and then 2 hours on group reflective supervision. And you do that for 12 months. And then there's the acknowledgement and a certificate that you have 24 hours of content, 24 hours of reflective supervision. And so I think part of it, I don't know that quality control, but rather the cohort and the process all together. And so it's more about that, I believe. I can ask the infant mental health endorsement coordinator, who wasn't able to rejoin us today. I can ask her very specifically if there are ever exceptions to that requirement, but
and I'm not asking for that.
Sure.
I mean, when I started the process years ago, when I was working at a home visiting program, I was supposed to be receiving reflective supervision from my boss. I wasn't, because they didn't have an understanding of what reflective supervision was. So even though it was part of the model, it wasn't being offered. And so I thought I was sort of in a bind. I thought, oh, are they asking for me to document my supervision with my boss as part of the requirement? And yet I know it's not reflective, versus going outside and paying, which I wish I'd stuck around to do that, because I was so stressed. I think I would have benefited from the paid supervision to pay for what I was supposed to be getting for my job. But I just found it ironic because I think the sites are supposed to be providing that. And I know Virginia, Early Impact or Home, whatever they changed the name to their home visiting education services, have started providing reflective supervision training for their supervisors, which is fantastic.
Yes. And to maintain endorsement, we're phasing in requirements around continuing education and ongoing reflective supervision. And it's expected that that is happening through your agencies, through your employment, and all that, so that it doesn't necessarily have to be an outside. It can be an outside person. And that's one of the reasons we're working on increasing our capacity for reflective supervision. And we're trying to use some creative strategies to think about what that is, being mindful of there. If you don't receive it as part of your workplace, that there may be an additional cost, and how to minimize that. Thank you. I think, who else in other states have had strategies to think about getting reflective supervision to all of your endorsees? I think that is one of the big difficulties sometimes, is all of the different components of the process. And then we want, obviously, everyone to maintain the endorsement afterwards. And how does that happen? Other questions?
Yeah, I was going to say, there was a comment on your survey. I wish there was more follow-up and opportunities to practice and grow once endorsed. I'm wondering, do you use the people who go through this process to then support other sites? Is there a way that you involve them if they're interested?
Yeah. So one of the things that has been nice, over the past 12 years, as Virginia has built the capacity through the system, there have been ongoing changes. And so we're wondering if this comment, it holds true for sure, I think, for everybody's, a lot of experiences, but also early on, there's the endorsement, and then it's kind of over. In the past couple of years, VAME has been really intentional about providing more continuing education opportunities and opportunities for connection through both VAME at large and then also chapters. And so each of the regions of Virginia has a chapter of VAME, and a lot of the chapters are providing their own monthly or quarterly activities. And so that ongoing connection piece has been increasing over the past few years. It is different from what I heard it was like earlier in the endorsement process. So we're hoping that is meeting a need that people had identified, that this wasn't the only person who said it. Quite a few people did say, hey, it was great, I did my endorsement, and then it kind of felt like it dropped off. So we're trying to figure out how to make sure that we have ongoing opportunities for connection across individuals.
Thanks.
Yeah. Other thoughts or questions, or what is the state of your state? As we think about the infant mental health endorsement process in Virginia, one of the things that we're also trying to ensure is that our endorsees are reflective of our population. And so making sure that we have the diversity of race and ethnicity. As we ask the question of, is English your first language? Do we have the capacity to provide services to families who don't speak English? And so that's been an intentional outreach that we're trying to do. Hopefully over the years we'll have more success with that. But that has been one thing that we really are trying to do. We also have had some success with, in some positions, being able to have a job description say infant mental health endorsement preferred, occasionally can be required. And so as we think about some of our professional development opportunities and statewide systems, that's another piece that we're trying to work and advocate throughout Virginia, to think about if you're going to be hiring someone who's providing technical assistance or professional development, do they hold the endorsement, or can they begin that process of endorsement?
Can I ask you guys, have you done any outreach to any of the bigger home visiting programs? Because I do think they don't know what this process is and may not be aware of it. And there might be some people who would be really interested.
Yeah.
And right now I'm supervising folks in DC, and so I can't promote it. When I was at Fairfax County, I started talking about this with some of my other peers, and I was trying to figure it out. So I didn't do a good job of explaining it to them, but also my bosses didn't understand why that would be useful to go through that process. I also think they looked at the cost and decided, why would I need this? But it might be good to do some outreach and educate people, because there's always a handful of home visitors that have mixed feelings about the job, and there are some that are really, really excited and engaged, but want more and are hungry for more and aren't getting it. And I think they, if you could find the right folks, they would embrace this. But I still think, I guess this is new enough that maybe not everyone knows what this process is. I'm still trying to figure it out. I'm going to apply and go through the process hopefully this year. But
applications are due in April. So yeah, we're accepting them right now for this next cohort. And I think that's a really great point of making sure that we connect not just with the statewide home visiting network. Early Impact Virginia knows about it, but are each of the individual agencies across counties, and across the different regions aware of it. And so I don't know specifically the outreach. Jackie Robinson Brock, who is one of our colleagues who worked on this study, has a lot more of that detail. And so I can bring that question back to her and see what does that outreach look like. We also work very closely with the new early childhood mental health coordinator that's now housed in DBHDS, Tracy Walters. And so part of her new role as that position was created, or modified from the previous person, Bonnie Grifa. Part of what changed with that, I think, is how the outreach is going to happen. And so connecting with specific home visiting programs is a great idea. And Alicia, I see you had a question about how to get started with the process. I was not in Virginia when we got started with it, but I did put in the chat the website for the Alliance for Infant Mental Health out of Michigan. And that's the parent organization that has the 30 different states that it works with to provide services. It looks like it says Missouri's in the discovery process. And so it looks like someone in your state has already connected with the Alliance to start trying to figure out what this is. And so what happens is that through VAME, the Virginia Association for Infant Mental Health, we have purchased the license to provide the endorsement process as, and then we use the EASY system that Michigan has set up, everything. And so I think connecting with someone at the Alliance, they can walk through how to set things up, what lessons have been learned from other states that are just getting started with that, and the cost, what that looks like, and the administrative structure. One of the administrative pieces is having someone who can do all of the outreach, as Beth was just talking about, making sure that people know about it and see the value, making sure that the funding is available, or figuring out what the different funding structures are, and then the administration requirement in terms of what are all of the behind the scenes pieces for the endorsement process. Each person who goes through the endorsement process also has a endorsement mentor. And that person is paired with them, at least in Virginia, to walk through building your portfolio. Once you do your professional development and reflective supervision over that first year, then you create a portfolio, and we look at the competencies, and those are available on the Alliance website as well as the Virginia website, and all of the states. We use those same competencies, and then you have to demonstrate that you have competency in each of the areas. And so you'll be asked for transcripts for your professional education, and then any professional development you have done that relates to those competencies. And then if there's an area where you don't have stated competency, that's one of the things that your mentor will work with of where are some ways to make sure you have that knowledge. So for example, in the cohort I was in, grief and loss is one of the competencies, but that's not an area where a lot of people often seek out a lot of professional development or haven't had a lot of training. And so we made sure that one of our conversations was about that. And then we tried to figure out where are some other ways that people can get more specific knowledge around grief and loss as we work with infants and toddlers and their families.
And we have another question in the chat, Christine. So Angie said that she's a LCSW working in the southwestern region of Virginia. She works with VMAP, where they provide mental health consultation and support to PCPs. And she said, looking at the map, that she noticed that they have very few providers with the infant mental health endorsement in their area. Are there resources for training opportunities that are available outside of the endorsement that providers in our area could access? And then maybe that could lead them towards the endorsement process.
That's a great question. And so I think while I'm talking, I'll pull up the Early Childhood Mental Health Virginia and VAME website. The VAME website has just been redone, and there's lots of great information on there. One of the kind of side benefits of the pandemic is that a lot of continuing education went online. And so that's one of the things that in fact, the classes for the endorsement process previously were held in person and then shifted to online. So everybody had to come together on a Saturday once a month and drive in from wherever you were to a central location. And then the past 2 years, they've been held online. And so even thinking about moving forward, are there going to be multiple opportunities? With the VAME, with the chapters, each chapter is trying to hold different activities. But so the chapter that is out in the Eastern region, so the Eastern chapter out here has sessions that they open up not just to their Eastern chapter members, but to anyone. And they hold those over Zoom. So I think there's a lot of opportunity there. I've also found through Georgetown, there's a lot of great, 1-hour webinars and lots of things through the Brazelton Center, through 0 to 3. I think just finding who are the other organizations that provide information about infant mental health can be really helpful. And I love your idea of starting little bits before we say, hey, do this large endorsement piece, but just starting those little bits of content can be really helpful. And I'm going to put my email in the chat. Feel free, anyone, to send me an email with any questions, and then I can let you know about different things that I hear about, and then connect you with Tracy, who's the early childhood mental health coordinator for our state, and her listserv, as well as VAME's listserv. VAME is a membership organization, but there are lots of opportunities that are provided with VAME, and that you don't have to be a member, but of course they encourage it. Other thoughts or questions?
Thanks. I look forward to starting this process, hopefully again. So.
Yes, glad that you are. Thank you so much. It was wonderful to see all of you. Thank you for joining us today. We appreciate it.
Thank you. We hope you enjoy the rest of the sessions today.